Hello everyone, myself S.SHARMILA, Department of Nutrition and Dietetics, Bharathiyar Arts and Science College, Women. Today I am going to take session on protein energy malnutrition. Let's see about in detail. So first we see about protein energy malnutrition. So this is the major emerging problem in our community. So we have to concentrate on the community nutrition and community awareness of our community. Okay, so first see about the definition of protein energy malnutrition. So protein energy malnutrition is the deficiency of macronutrients or energy and protein in the diet. So that's mainly due to the deficiency of nutrients, especially macro and micronutrients. So we have to be very clear in the selection of particular food item in our diet. That's the major concept here. So it's a nutritional disorder which affects all the segments of population like children. So basically it will directly affect the children, especially for the preschool going children. So women and adult males, particularly from the backward and downward communities. So that's because of the very poor nutritional awareness. That is the basic thing here. So here we have the different types of protein energy malnutrition. In it, two main classification in it. First one is the clinical form and second one is the subclinical form. So in clinical form, we have to see about kwashiorkor, marasmus and marasmus kwashiorkor, and in subclinical form underweight, wasting and stunting. So let's see in detail. Next slide. So first we see about the kwashiorkor. So that is the kwashiorkor cases come under the protein energy malnutrition, that is come under clinical cases. Okay. So the kwashiorkor is an African word. Its meaning a disease of the displaced child. So displaced child that directly explain about the child category. So the difference between the healthy child and unhealthy child will easily determined in the kwashiorkor cases. That is, who is deprived of adequate nutrition. So here you see the word adequate nutrition. So adequate nutrition is very must for each and every kid in our community, but due to the deficiency and due to the lack of nutritional awareness, the adequate nutrition is not followed by the particular community of the persons. So mostly in children between the ages of 1 and 3 years, when they are completely weaned, that is taken off the breast. So here we have to know about the ages of the child, that is between the 1 and 3 years of the children are mostly affected due to the kwashiorkor cases. So when after the weaning will start, the nutritional deficiencies will occur. So what is the meaning of weaning? So whenever after the pregnancy, after the delivery, after the period of 1 and 3 years of the kid, the mother will start the weaning process. Weaning means they will stop the breast milk, and after this they will provide the normal food from the home itself. That is called as weaning. The three essential manifestations or signs of kwashiorkor are: first one is the edema, growth failure and mental changes. So these three symptoms are very important in the kwashiorkor cases. What is edema? That is swelling of feet. And next one is the growth failure. So growth failure in the sense the child doesn't have any proper growth, that is in the physically and mentally, that's it. And mental changes, the psychological changes will happen in the particular kwashiorkor cases. We compared with the normal kids, the kwashiorkor kids are little bit psychologically challenged. That is the thing. Next one, the clinical signs of kwashiorkor in detail. So first see about the edema. So what is the definition of edema? The accumulation of fluid in the tissues. Usually it begins with the slight swelling in feet. So first the accumulation of fluid will occur in feet and gradually spreading up the legs, and afterwards it's spreading into legs, and later it will spread into the hands and face. It may also have edema. So in kwashiorkor cases, the leg will have edema and face and hands have the chance for accumulation of fluid. And next one is the poor growth. So what is poor growth? The growth retardation. So I already told you. So due to the deficiencies, the normal growth pattern is not there. So compared to the normal healthy person, kids, the kwashiorkor kids are little bit lower in their growth. So that is growth retardation is the earliest manifestation. So first of all, we have to concentrate on the weight of the kids. So after the delivery, the newborn babies are weighed by the physicians. So the weight is the proper management. The weight management is very, very important. So if there are any changes in particular kid or newborn baby in the weight itself, means we have to discuss with our child specialist, then they will prescribe the further treatments. Next one is the child will be lighter and shorter than its normal peers of same age and weigh about 80% or less of their normal peers. So in kwashiorkor cases, due to the deficiency, the poor growth will occur. So the poor growth, due to the poor growth, the weight management is very, very poor in the particular kwashiorkor cases. And sometimes in cases of gross swelling, the body weight may be relatively higher. The child will also be wasted. That is, wasted means very thin in nature. The child's arms and legs will appear in the result of wasting. So wasting in the sense the thin skin structure, that is called as wasting. Next, about the mental changes. So what is mental changes in it? Means the kwashiorkor child has no interest. So that kid don't have any interest in playing and chatting with any other persons, especially that kind of kids are very much protective themselves and they kept themselves in a very secured manner like that. So that is the problem here. So the psychological changes will occur compared with the normal healthy child. That is the point here. And previous slide. So the child will also be irritable. So what is irritable? So that is due to the psychological issue. They are not in a normal manner. They always in a irritable character. So and prefers to stay at one place and in the position. They don't go and mingle with other persons. They are not cooperate with the parents. Like problems are occur due to the kwashiorkor symptoms in particular kid. Next slide. So what are all the other signs which may be present are? So which may be present. So previous slide we saw about the three signs and symptoms. So these three symptoms are very, very crucial and very occurred in all the cases, and these are all the other which may be present in the particular case. So what are all that means? The hair changes, skin changes, moon phase and micronutrient deficiencies. So what is hair changes? What is the difference in hair? So compare with the normal healthy kids, the hair changes will occur in kwashiorkor cases. So what is the nature in it? Means the color changes and texture changes and appearance changes will occur in kwashiorkor cases. Especially the hair will be easily brittle, and if we are plugging the hair, means there is no pain sensation in the particular place. So this is the main problem in the particular kid, and the color, that is in a coppery red color. So compared to the normal persons and normal kids, the color of the hair will be look like a coppery color. So coppery color in the sense we easily identify that kids are come under the kwashiorkor cases. So that is the point here. We will see about it. In kwashiorkor, the hair losses is also there. Hair losses its healthy sheen and becomes silkier and thinner. It's not in a thick, it's very thinner. It takes coppery red color, that is referred to as discolored hairy. So this is otherwise called as discolored hairy, and you could easily pluck. Easily we have the capability to pluck the hair and small tufts of the hair without causing any pain. I already told you it's referred to easy pluck ability, and just by passing your hands through the hair. so easily we are plucking the hair. That's the point here. And what about the skin changes? In many cases, dermatosis, that is skin changes, is seen. Such changes are common in areas of friction. So in areas of friction, and if we see the particular patient, in the sense the color of the skin easily describe about the deficiency of micro deficiency and macro deficiency, that will implies in the skin color of the particular patient. And next one is the moon phase. So in kids we have to concentrate on the face, in the sense means it's very chubby, it's very pinky color like that. But in this case, in kwashiorkor, the moon phase will occur. So that kid is very different from other kids. So the face is also not good. No, it's looking bad like that. So what is that is come under moon phase. So what is that? The cheeks may seem swollen. So it's like the cheeks are swollen, and then with fluid or fatty tissue, and often be slightly sagging. So during the kwashiorkor cases, the face is not normal. So the fluid accumulation is there, and the cheeks are very swelling, and that causing the moon phase. And next one is the micronutrient deficiencies. So come under nutrients, we have the segregations, that is macronutrient and micronutrient. Here in Marasmus, here in this case, the micronutrient deficiencies will cause so many deficiencies that automatically interfere with the metabolic process inside our body. That is the point here. Almost all the children manifest anemia. So anemia is the major problem among all the age group of the community. So here also the preschool kids and 1 to 3 years of kids are very suffered by the case of anemia. So due to the iron deficiency of some degree. In these cases also the micronutrient deficiencies will cause anemia. And next one, the eye signs. Due to the micro deficiencies, the eye signs of vitamin A deficiencies are also common. And next one is the manifestations of the vitamin B complex deficiencies are also noted in many cases. So in this point I have to conclude it. So due to the micronutrient deficiencies, all the metabolic processes are disturbed. So we had to concentrate on the diet selection, especially macronutrient and the micronutrients, in order to prevent the all deficiency syndrome in particular children. Okay, so in our home we have kids like that, so we have to concentrate on the selection of diet. It's very important. Next slide. Next we see about two types of malnutrition that's come under the protein energy malnutrition. So we already saw about the signs and symptoms of PEM. So in that the first sign is edema. So this is the picture representation of edema, and here the two picture representation is here, the kwashiorkor and marasmus. So this is the two different kinds of kids here. So this is the first one, that is thin and brittle hair and moon face and bulging of abdomen cases in kwashiorkor. In marasmus, the thin and brittle hair will occur, and this is called as simian faces or monkey's faces, and this is the loss of muscle mass. So this is the picture representation about that kwashiorkor and marasmus. Next slide. So now see about the marasmus. The marasmus is common in children below the age of 2 years. So the marasmic children are so weak that may not have even energy to cry, which most often is barely audible. So that marasmus kid don't have the energy to cry itself. That is the point here. The child is extremely wasted with very little subcutaneous fat, with the skin hanging loosely, particularly over the buttocks. So the appearance of the skin is very thin, and muscle wasting and skin wasting is occur in marasmus cases, and edema is absent, and there are no skin and hair changes. So in kwashiorkor cases we have edema and skin and hair color changes. That's the main difference between kwashiorkor and marasmus. So however, frequent diarrheal episodes leading to the dehydration. So due to the macro and micronutrient deficiencies, the metabolic process will disturb. So due to the disturbances, the digestion process is not in a proper manner. So that's why the diarrhea will occur. So continuous diarrhea will cause the dehydration in particular patient, and that will automatically provide the micronutrient deficiencies, especially for vitamin A, iron and vitamin B complex are very common in particular cases. Next slide. So this is the signs and symptoms of marasmus. We already saw the picture here, that is sunken eyes and thin and bony faces and ribs clearly visible through the skin and poor growth. So that's because of the micronutrient deficiencies. So calcium deficiency, protein deficiency and iron deficiency also. So here the signs and symptoms of marasmus is the extreme muscle wasting, that is skin and bones are very poor in health, and loose and hanging skin folds. So the skin is not healthy in the sense that skin folds will automatically appear, and old man's or monkey's faces will occur, and absolute weakness, that is whole metabolic process is disturbed, means it automatically provide all the deficiencies that automatically provide the weakness to the particular baby. That's why that baby don't have the energy to cry itself. Next slide. So next one is the marasmic kwashiorkor. It's come under the clinical differentiation of the PEM. So sometimes in areas where PEM is common and malnourished children exhibit the features of both kwashiorkor and marasmus, such changes could occur during the transition from one form of severe PEM to the another. So the treatment is very must for any cases. If the treatment is not continued, that will cause severe problems, that is marasmus and kwashiorkor together, and these children will have extreme wasting of different degrees, that is representing the marasmus, and also edema. Edema is nothing but accumulation of fluid, that is a sign of kwashiorkor, and they may also occurred in the man also. So not only for the kids, it's also in a man and women also it will occur. And next one is about the signs and symptoms of marasmus kwashiorkor. So extreme muscle wasting, that is skin and bones of very weak in nature, it's not in healthy, and loose and hanging skin folds, and old man's or monkey's face will occur, and absolute weakness and edema will occur in the marasmic kwashiorkor cases. Next slide. So what is the treatment? So the diet is a very common treatment for all the deficiencies and all the diseases cases. So I already told you, due to the deficiency only the protein energy malnutrition will occur. So we have to concentrate on the diet selection and the nutrient selection also. So here the diet treatment for PEM, the treatment of cases kwashiorkor or marasmus involves mainly providing appropriate nutritional support. So this is a main word, that is nutrition support is must for kwashiorkor or marasmus cases. The child should receive a diet that provides adequate amounts of energy and protein. So this is a come under macronutrient. So energy and protein is very must for this kind of kids, and both of these are required in larger quantities than normal. So according to RDA, we are following the diet pattern. So for these cases, we have to increase the energy and protein values compared with RDA. And next one is the child should be given the following concentrations. So what about the energy and what about the protein here? So energy, we must provide 170 to 200 kilocalorie per kilogram of body weight, and for protein 3 to 4 gram per kilogram of the body weight. And about the vitamins and mineral supplements, these are all come under the micronutrients, we all know. So all cases of severe PEM require multivitamin preparation to meet the increased demands during recovery. So during recovery, the micronutrient is playing a very important role for recovering the cases. It's from kwashiorkor or marasmus. So iron we have to provide, that is 60 mg, and folic acid, that is 100 mg we have to provide. It may be given daily to correct anemia. So anemia, it's a very big issue for all the cases. So we have to concentrate on the iron and folic acid supplementation. Next. So we had to concentrate on the oral rehydration. So for kids, we have very much we have a trouble to give the feeding and give the diet pattern like that. So on that part, we had to move on to the part that is oral rehydration therapy. So that's the main treatment for the marasmus and kwashiorkor cases. So since diarrhea is very common in severe PEM, correction of dehydration is the first step in the treatment. So during PEM, if the diarrhea will happen, the correction of dehydration is the first step to maintain the water level inside the body. That is the main thing. So, homemade, that is salt with sugar mixture or commercial oral rehydration solution, that is ORS powder, can be administered to correct the dehydration. That is the point. And next one is the intravenous IV fluids. So, intravenous fluids are required only in severe dehydration. So, if the kid is come under normal dehydration, in the sense we provide a homemade solution. If the cases is severe, then only we are moving with the IV fluids. It's only based on the physician advice only. And next one, the control of infections and infestation. How we can control the infections and infestation. So, in all the deficiencies, all the disease conditions, the main problem is that infections only. So, we have to be very clear in the avoiding infections, and we must be protect our child and our family from the any infections. We have to follow the hygienic and sanitation in a very proper manner. So, that is the point here. So, appropriate antibiotics should be started immediately, since infections are the immediate cause of death in many children. So, in PEM cases, the antibiotics should be followed by the physician in a very proper manner. That is a very important thing. When the antibiotic is not there, the kid is easily absorbing all the infections with that. So, that will be a very big issue for the particular kid. That is a point here. And children with intestinal infestations like giardiasis and ascariasis should be treated. So, this is the infestational problem. So, we have to be concentrate on it, and prevention is better than cure. So, it becomes extremely important that we make sincere efforts to prevent and control the PEM. So, prevention is control better than cure. So, that we have to concentrate on our diet pattern and the treatment pattern and all those things. Next slide. So, I already told you that PEM is the emerging problem in our community. So, we have to be concentrate on the community awareness, community nutritional awareness. So, for that our government, state government and central government, they are established so many of programs for our community. So, these are all the list here. So, supplementary feeding programs. So, what are all the programs followed by our community? Let us see about it. So, food supplementation programs have a very important role to play to combat malnutrition. So, it's a very important thing, that is food supplementation is very important thing to combat malnutrition. The aim of these supplementary feeding programs is to improve the nutritional status of vulnerable groups, especially vulnerable groups, through distribution of food supplements. How they are planned, how they are providing supplements to the community, that is the point here. So, following supplementary feeding programs are nowadays in a following manner. So, that is the first one, the National Program of Nutritional Support of Primary Education, that is midday meal program, and second one special nutrition program, third one Pradhan Mantri's Gramodaya Yojana, that is always called as PMGY, and Balwadi feeding programs and composite nutritional programs and applied nutrition programs. So, these programs are currently available in our community. All the persons, all the pupils are very much interested to utilize these programs, and this will be a very good opportunity for our community to improve their nutritional awareness, to avoid all the deficiencies, syndrome with their kids and family. So, from this I have to conclude my session, especially in protein energy malnutrition. So, we have to be very aware about our nutrition and health aspects. So, through the government we secured by all the supplementary programs, and we have the knowledge about nutrition point of view. So, all the very best. Health is wealth. Thank you.